Okay, so we are now going to look at one health policy, and we will discuss some questions. Okay, so our first policy is the 2010 to 2015 government policy on the council tax reform. So this policy starts by stating what the issue is, and the issue is that council tax bills in England has more than doubled between 1997 and 2011. So they want council taxpayers to be able to veto excessive rises in order to reduce living expenses. So basically, more value for your money. If council tax bills start to rise, we get the right to say what's going on. Okay. So how are they going to do that? They're going to pump in 5.2 billion in order to freeze council taxes for the lifetime of this parliament. So if your council taxes increase, that's because this was 5 years ago. Right, and then they go ahead to make a list of all the things that they're going to do. They have got some background information as to why they found out that this continuous rise in council tax is an issue. Who have they consulted in order to get that information? And here's a whole bunch of stuff that they were going to do. Okay, right. Now, I would encourage that you take the time and read this through. Unfortunately, I can't go through this in as much detail, obviously, because this is a recording. Right, and our second health policy is the 2010 to 2015 government policy on harmful drinking. So they've gone ahead and explained what the issue is. So in England, the low-risk guidelines for alcohol state that men should regularly drink more than 3 to 4 units per day, and women shouldn't, and women shouldn't regularly drink more than 2 to 3 units per day. Regularly means drinking most days or every day. Drinking more than the amount suggested by the guideline can damage a person's health. For example, alcohol is one of the biggest behavioral, keyword there, risk for disease and death, as well as smoking, obesity, and lack of physical activity. In 2010 to 2011, there were 1.2 alcohol-related hospital admissions and around 15,000 deaths caused by alcohol. This isn't only a burden on individuals and families, but also a drain on hospital resources and public money. Every year, alcohol-related harm costs society £21 billion. Wow. Okay, so there you have your issue. Now they've listed, if you like, plan for the future. We want to reduce the alcohol misuse and its harm it causes. So we want to see a change in behavior, a reduction in the amount of alcohol-fueled crime, a reduction, etc. So, and then they've gone out to how they're going to, what actions they're going to take. It's quite detailed. So you have an example here of two different kinds of public health government policy. Okay, let's go back to our slides. Sorry. Okay. Right, so let's answer these questions then. So looking back at the council tax reform, what is the focus? The focus is the rise in council tax. So what issue is the policy trying to address? It's trying to address the constant rise in council tax, and in order for people's living expenses and quality of living to be improved. What theories of health inequality has been highlighted? Now let's remember what our theories are. So we have the behavioural, structural, and the psychosocial. Remember that the behaviour says differences in behaviour is why we have differences in health inequality. Material says the differences in income, the differences in material and structure is the reason why we have health inequalities. Now, looking at this government policy, I have to say that the theory highlighted here is the materialistic / structural theory. Now, what is the relationship between theory and policy? They're recognizing that if they get people to stop spending as much money on council tax, they will have a better quality of life. The theory of the materialistic structural theory says the differences, the presence or absence of money is the reason why people have poor health. So can you see the relationship between theory and policy? The government is recognizing that material and structure is the reason why we're having health inequality. So they come up with this policy that brings about a reduction in people's spending in order to improve their quality of living. Okay, so I hope it's starting to make more sense what this question, what this 2.3 is asking you. It's asking you, okay, you now know what the health inequality theory is. Can you find a relationship between these theories and the development of health policy? Now, the last question is up to you to do your research. How has this policy improved inequality? Has it been effective or not? Okay. Now, I think that it was at the time, at the time of the previous government, but it is no longer the case, as most of you who pay council tax will know it has probably been increasing and not frozen in the last 5 years. Okay, the second policy we looked at was the harmful drinking. And what is the focus? The focus is on changing people's behavior, and the behavior in this case is harmful drinking. What issue is highlighted? Poor harmful drinking. Okay, kind of answers both answer the same question. What theory of health inequality has been highlighted? This is pretty simple. It's behavior. Okay. The government recognizes that if we can improve, if we can adapt people's behavior, right, we're going to see a reduction in how much money the government spends due to alcohol-related deaths, violence, accidents, etc. What is the relationship between theory and policy? It's basically the same thing I've just said. Behavior theory believes that behavior theory believes that behavior is the cause for poor health. This policy is saying we need to change people's behavior so they can have better health, and we can stop spending £21 billion a year. Okay. Now, has this policy improved inequality? It has, but I want you guys to do some research on this because I found it really interesting. Find out what has happened since 2010, 2015 with regards to drinking. Has it come down, or has it gone up since this policy? Okay, so your class activity or assignment, if you don't have the time right now, is to answer these questions, but with regards to these health policies. So this is the new government action to create stronger, more integrated Britain, and the no health without mental health policy. I'm going to put links for these in the activity box below, and I hope you guys take the time to answer these questions. Right, so I will see you on Teams. So I will see you on Teams in about, I don't know, in a bit. Okay, bye bye.